Good evening. I'm Siobhan, nurse practitioner student, and I came to do an assessment on you. First, I'm going to start out by asking you some questions. I'll get a medical history on you. It'll be your reason why you're here, past medical history, um, family history, social history, and surgical history. All right, is that okay with you, Mr. Kaufman?
Yes.
Do you have any questions?
No.
Okay, and what brings you in the clinic today?
A sore throat.
Okay, so any other complaints?
No. That's
Okay, so today we're going to do a focused assessment on your throat.
Yes.
Okay, so I'll start with the questions. Is that okay with you?
That's fine.
Okay, Mr. Carter, you said you came in with a sore throat.
Yes.
Okay, when did this sore throat start?
About 2 days ago.
Okay, what do you feel like exacerbates it? What makes it worse?
When I cough, it's trying to swallow.
Coughing and swallowing?
Yes.
Okay, so when you coughing, you're saying that the cough made it sore after you cough for so long. Okay, when you cough, are you coughing up anything, or is it a dry cough?
It's a dry cough.
Okay, it's a dry cough. Okay. Have you tried anything? Has anything worked to make it not hurt so bad?
I've been taking cough suppressants and it's been helping.
Okay. On a scale of 1 to 10, what's your pain right now?
About a 5.
Okay, 5 out of 10. And when you're coughing, what's the pain?
About a 9.
Okay. And when you take the cough suppressants, excuse me, what does it make the pain? Like, what does it bring the pain down to? Or does it?
Probably about a 2.
Okay. Yep. Okay. And you said it's been going on for about 2 weeks, and you noticed that the cough made it worse.
Yes.
Your cough is non-productive, so you're not coughing up anything.
No.
Okay. And is the cough worse in the morning or in the night?
In the night.
Okay. Do you have any past medical history, meaning anything that has had you in the hospital for any reason?
No.
Or anything that you have been diagnosed with?
No, ma'am.
What about as a child? Do you have any childhood illnesses?
I had chicken pox.
Chickenpox? Okay. And how old were you when you had the chickenpox?
About 8 years old.
And so you didn't have, were you hospitalized, or were you able to stay at home and be treated?
I was able to stay at home.
Okay. Okay. And so, no past medical history. Okay. Do you have siblings?
Yes.
How many?
15.
And all of them are still living?
Yes.
Do they have any chronic illnesses?
No.
Okay. What about your mother and your father? Are they still living?
My mother's still living.
And how old is she?
She's 79.
Okay. And does she have any chronic illnesses that she has ever been hospitalized for?
Not hospitalized, but she gives hypertension and she takes blood pressure pills.
Okay. So she takes it. Has she? You said she's never been hospitalized, so that means she's complying with her medications.
Yes.
She takes her medicine.
Yes.
Okay. Okay. And what about your father? How old is he?
My father passed when he was 58.
Oh. Okay. And do you know what he passed from, or?
Brain aneurysm.
And he was 58 years old then?
Yes.
Okay. All right. Do you have any children?
No.
So anybody in your family have any history of cancer?
No.
Any type of other than your father had aneurysm? That's the only family history that you have?
Yes.
Okay. Have you ever had surgery?
No, ma'am.
Okay. And you live alone? Are you single, married, or divorced?
I live alone.
Single, married, or
Divorced.
divorced? Okay. Are you heterosexual?
Yes.
Okay. Are you sexually active?
Yes.
Do you use condoms?
Yes.
Okay. And how many partners?
One.
Just one at a time? Okay. Okay. Do you drink or smoke cigarettes?
I don't smoke. I occasionally drink.
Social drinker.
Yes.
How many drinks would you say you occasionally drink? I want per week.
Maybe 2.
2 drinks per week. Okay. Do you use any recreational drugs?
No.
Do you feel safe at home?
Yes.
Okay. And you're a non-smoker. No marijuana, no. Have you smoked have you ever smoked in the past?
No.
Okay. Do you have any questions or do you have anything that you want to tell me about or address today
No, ma'am.
other than your sore throat? So your sore throat is what we want to address today.
Yes.
Okay, so we'll do a focused assessment. I'm going to take a look at your ears, your nose, the inside of your mouth, and I'm going to listen to your heart. I mean, not your heart. I'm going to listen to your breath sounds and make sure you don't have an upper respiratory infection. And I'm going to also take a look at your lymph nodes. I'm going to feel for your lymph nodes to make sure we don't have any inflammation anywhere, okay?
Okay.
Okay. Okay, Mr. Cawthorn, I'm going to just start by inspecting you, making sure you don't have any swelling or anything like that. So let me take a look. If you open your mouth for me, say, look at the roof of your mouth. You lift your tongue up for me. I see you got some braces, huh? You want those teeth nice and straight, huh? Lift your tongue out for me. Go side to side. Okay, that's cranial nerve 11. If you say ah, lift your tongue out and say ah. Okay. If you'll lick your tongue out and say ah for me. And that's checking cranial nerve 10. Okay. It looks like the back of your throat is a little red, slightly pink and red. And that may be from a cough, and I don't see any exudate. No tonsils. No, your tonsils are not swollen, they're 1. And it just looks like the back of your throat is a little irritated from all the coughing. That may be coming from coughing. But we'll go further with the assessment, okay?
Okay.
Alright, let me take the feel for your lips. You don't have any pain in your lips at all, huh?
No.
No abrasions, no lesions. They're pink and moist. Mucous membrane's moist. I'm looking at your gums. They're nice and pink. No redness or swelling. No bleeding. Okay. Buccal mucosa is pink. No dental caries. No missing teeth. Okay. Lick your tongue out again. Let me see the side of it. Okay. And lift it up. Okay. Lick your tongue out. And I see say ah again. And the rise and fall of the uvula and the back of your throat is cranial nerve 9. When it moves up and down. Okay. Your throat looks a little red. And so I'm gonna take a look in your nose to see if I see any drainage. Okay?
Okay.
Your nails are pink. They don't seem inflamed. Have you been blowing your nose? They're just slightly pink. No redness, no swelling, no deviated, no perforated septum. Terminus are nice and moist. A little mucus, but nothing major. No lesions. Okay. Get another one. And I'm going to take a look in your ears. I'm gonna take a look in your ears as well, because sometimes you can have a little drainage from your ears. Okay, in the back of your throat. It may be what that's causing the cough. Okay, and I'm gonna pin the pin. Are you having any pain here?
No.
Okay. No pain when I pull on the helix, the pinna, or the tragus.
No.
Okay. See little earwax. See the cone of light is at 5 o'clock. No fluid, no redness. The tympanic membrane is pearly gray. I see the umbo, the pars blasted at the top. The umbo right here on the right. And earwax, you need to clean it. I see a little earwax. Okay. I'm gonna take a look in the left ear. Okay, I see a little earwax. Cone of light is at 7 o'clock. Just pearly gray. No redness or swelling, no fluid noted, no whiteness. Just earwax. So that's normal. Okay, Mr. Cawthorn. I'm going to inspect your neck. And I don't see any swelling. And I'm just gonna, is there any pain here?
No.
Okay. Pre-auricular. And you can just stop me if you have any pain, okay?
Okay.
Post-auricular. Occipital. Deep cervical. Superficial cervical. Tonsillar. Submental. Supraclavicular. Trachea is midline. And I'm gonna go to the posterior, and I want you to swallow for me. Does that bring pain to you, sir?
Yes, ma'am.
Okay. All right. All right. Well, listen to you. You'll take a deep breath for me. Deep breath. Deep breath for me. And let it out. Take another deep breath for me. And out. Deep breath. 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 And out. Deep deep breath and out. Okay, Mr. Cawthorn, your lungs seem to be clear to auscultation, and what that means is as I listen, I don't hear any extra breath sounds, no rails, no crackles, no rhonchi. That was just making sure you didn't have an upper respiratory infection. You're not wet, you're dry. So I'm thinking that your cough is causing a little irritation to your throat, and that's where it's coming from. And so we just need to kind of moisturize your throat to keep it from being so dry. And what has caused your throat to be so dry is your coughing. And as you hack it more, it causes it to be more dry. Okay? All right. Do you have any questions for me?
No, ma'am.
Okay. Well, at this moment, I finished my assessment on Mr. Cawthorn, and today we did a focused assessment on his throat. I examined his ears, his mouth, his nose, and his lymph nodes to make sure there was no inflammation there, and I checked his breath sounds. Everything was clear, unremarkable, no abnormalities. The back of his throat was a little irritated, but I'm thinking that's coming from the cough. Mr. Cawthorn has reported that his symptoms are alleviated with cough drops, so I'm going to recommend that he keeps those and he keeps his throat moisturized. He has not had a productive cough, so he's not producing any sputum. If we had produced sputum, I would probably take a throat culture. When I looked at the back of his throat, his pharynx and his tonsils, they were clear. They were not swollen. They were had no exudate. They were clear pink and moist. I asked Mr. Cawthorn if he had any questions. He does not have any questions. So I think that completes our focused assessment on his throat. Thank you.